COVID-19 has had a profound effect on the health of people living in Southeast Asia. But the most interesting thing about COVID-19 is how different that effect has been. I'm going to talk about why it might be that COVID-19 has affected some countries more than others and what it means for the health of people in Southeast Asia. COVID-19 is a respiratory infection, which means that it's transmitted largely through the air or through contact with respiratory secretions. And so for that reason, people who live in crowded environments or people who are in close contact with infected individuals are at a high risk of becoming infected themselves. And this has important implications for how COVID-19 spreads. What it means is that people who live in crowded environments or slum areas or migrant workers who live in crowded accommodation can be much more likely to contract the disease. And a bit like on cruise ships, the transmission of disease can be very fast if it occurs in those environments. And that's one of the reasons why there's been a huge surge of cases of COVID-19 in certain parts of Southeast Asia. As an example, in Singapore, although they had a very good initial response, about a month into the pandemic, there was a very rapid rise in cases. And this can be explained by transmission within migrant worker housing and a lack of access to early detection of COVID-19 in that setting. Similarly, in other settings where there's been a very low population density, such as in Laos or Cambodia and some rural areas, there have been very low numbers of cases detected. And so that explains a part of the variation between different settings in Southeast Asia. The figure that you can see here shows that about 222,000 people have been infected with COVID-19 in ASEAN countries. And although this is a very large number, it's been much less intensive than in Europe or in North America to date. There's been 5.5 million tests performed and around 6,000 deaths. And this compares quite favourably to other countries in Europe or in North America where the mortality has been much higher. The figure here shows a significant variation in the case notification rates. And that can be explained by a number of factors. First of all, where there's more testing, there is more cases diagnosed. And so in Singapore, where there's been very high numbers of tests per capita, the case detection rate is very high. But in contrast, in some settings, even where there's been high levels of testing, there's still been low numbers of cases. And that suggests that community transmission is also very variable between countries. On the right-hand side, you can see an image which shows the mortality rate between different countries. And there are two standout countries in ASEAN for mortality, one of which is Indonesia, and the second is the Philippines. Both of these countries have had much higher mortality rates than other parts of the region. And this is likely to be explained by high numbers of cases and relatively limited success in controlling spread throughout those communities. There's been some standout examples within Southeast Asia of countries that have controlled COVID well. One of those is Vietnam. Remarkably, Vietnam responded very quickly to the COVID pandemic, and at the very beginning of February it closed its borders to Chinese migrants and instituted very rapid and intensive contact investigation and quarantine. The impact of that very rapid and early intervention was that Vietnam has seen fewer than 400 cases in total and reported no deaths up to now, in spite of having a very large number of tests performed. This indicates the potential for countries in the region to act effectively and decisively. The reason why Vietnam was so successful in doing this was in part because of its prior experience. SARS-CoV-1, or the SARS virus from 2002-03, had affected Vietnam and taught it many important lessons about how to quickly respond to a viral pandemic. And so other countries which have instituted similar rapid restrictions have also seen very low numbers of cases. In contrast, I've mentioned Singapore as a standout case of where the disease has spread very rapidly. You can see here an image of one of the migrant worker dwellings in Singapore, which was a source of a very large proportion of the cases in the country. And this illustrates the way in which health inequality can predispose countries to having very rapid transmission of the infection. In Singapore, although the transmission rates in the Singaporeese community are very low, it was quickly discovered that in the crowded and relatively less healthcare served areas of the country, that in fact transmission was very rapid. And so over 85% of cases at some stages of the epidemic were occurring in these populations. And this, I think, highlights the way in which the coronavirus that causes this disease tends to find the weak points within healthcare systems and tends to spread very rapidly once it gets a chance. And in particular where case detection is low, and so therefore it can spread before people are able to institute appropriate quarantine. You can see an image here from a hospital in which a patient's being treated for a respiratory infection. But this isn't actually COVID-19, this is a patient who has tuberculosis. And I've included this slide to make the point that the health impacts of COVID-19 go and will go far beyond just people having viral infections. In fact, the consequence of the huge cost and burden on the health system due to COVID-19 has big implications for other diseases as well. Tuberculosis is one example of a common respiratory infection which is endemic within Southeast Asia. Because of COVID-19, it's likely that fewer people will be detected and that transmission of tuberculosis is likely to increase. Similarly, funding for other important programs such as HIV control, as well as prevention of other infectious diseases, is also likely to drop off as a result of the focus on COVID-19. And so, as a region, Southeast Asia needs to be focusing not just upon COVID-19, but also its flow-on effects to the healthcare system and to the health of other vulnerable populations. So in conclusion, COVID-19 has had a very variable effect in Southeast Asia. There are some standout successes, and then there are places where some lessons have been learned about how COVID-19 can spread in crowded environments where healthcare is not so accessible. And the lessons that we can learn from Southeast Asia, I think, can be extrapolated to other parts of the world.